Well, hello, I am Dr. Chandra Mickles. I'm the Director of Professional Education at Alcon and was so thrilled to be part of the panel, Bridging Cultures in Chronic Eye Disease Care. One of the biggest takeaways from that session was that, managing these chronic diseases in communities like the Latino community and the African American community is or really requires thinking beyond just diagnosis. We really cannot do this just with clinical knowledge alone. It really requires building trust as well as effective communication. So let me talk a little bit more about effective communication. And there are three key tips that I have learned over the years to effectively communicate with patients about chronic eye disease conditions that are often silent, right? Patients don't have symptoms. So the first one is really listening before educating. You want to make sure that patients really understand their condition, right? And approaching it first that way. You also, number two, want to make sure that you're explaining it in relatable language, right? Patients really remember stories, they remember analogies instead of clinical terminology. And the third is connecting their condition to what truly matters to them. When I say that, that could be, hey, I want to see my grandchildren play outside, or it could be that I want the independence to drive. And why I really focus on effective communication because, these chronic conditions really hit home for me and it's really personal for me. My 60-year-old uncle completely lost his vision due to diabetic retinopathy. And what's the heartbreaking part? It wasn't that the disease wasn't detected in time, it's because of lack of awareness. He really didn't understand the risk, and that's why clear, effective communication is incredibly important. The other big key takeaway from this is also building that trust. These communities understandably have some mistrust. And so you want to make sure that you build that trust. And that trust begins with empathy as well as transparency. Patients really want to feel like you genuinely care about them and that you are on this process with them or progress with them, and that you are partnering with them to make sure that you protect their vision. The other piece is transparency and making sure it's clear that they know what's going on with their eyes. And we all know this, a picture is worth 1,000 words. And we have so many powerful tools that we can use, whether it's imaging, whether it's other patient education tools like photos that can really help patients understand their condition. So the key takeaways is that clinical knowledge is not enough. You got to definitely be clear in your communication as well as build trust.
So going off of that, where do you see gaps existing in patient education in terms of demographics? Say an OD is practicing in a population that is primarily Latino or African American. How do you take that knowledge of where those gaps may exist and then replicate that in your practice?
Yeah, I think one of the gaps in education is really having the resources available to effectively educate those patient communities, especially with the Latino community. I hear often, man, I wish I had more educational resources in Spanish. And so, one of the things that I'm really proud of that we just announced at Alcon is that we supported the Glaucoma Foundation in converting or translating their educational materials into Spanish. And we're going to do a lot of that for the rest of our assets to make sure that, especially the Latino community, really understands the conditions that they have. Cultural competency is also very important. And I know that some of the schools and colleges of optometry are providing that education, but we as industry can support that further by supporting their initiatives and ensuring that the future leaders in eye care have that education, as well as the faculty and other optometrists. I'm grateful for the cultural competency education that I was trained on when I was faculty at Nova Southeastern University. But we got to continue to expand that to make sure all ECPs feel confident in educating their patients about these conditions.
So, kind of connected to that as well, you had mentioned, patient trust is a huge factor in patient retention. So, is there any different approach that should be taken in building those relationships with patients of certain demographics in order to retain them?
So, as I mentioned earlier, there's definitely this understandable lack of mistrust of doctors in these communities. The African American community, especially, has been tested on, right? In really inappropriate ways. So you want to make sure that you lean into trust as a treatment plan. And what I do know is when patients trust us, they're more likely to comply to our treatment regimen. When they trust us, they will follow through. And then we put that trust with clear communication. That's how we can save their vision.
Anything else that you wanted to add that we haven't touched on yet?
The one thing I do want to add is that it's really going to take all of us together, whether it's industry, whether it's clinicians, whether it's great organizations like Latinos in Optometry and the National Optometric Association, to really create meaningful change. A lot of these conditions are silent, but when we speak up and when we take action together, that's how we really save